Last year, we did a series on the opioid crisis, with an episode on some of the issues standing in the way of addressing the many problems underlying that crisis. One of those issues is the extra training required for providers to prescribe buprenorphine, a treatment option for individuals with opioid use disorder. There's been pushback against this extra training and the associated waiver for years, and it looks like we might finally be seeing some change. And that's the topic of this week's Healthcare Triage. The X-waiver is a product of the Drug Addiction Treatment Act of 2000, passed by Congress in response to the growing opioid crisis. It's a waiver to prescribe buprenorphine that can be obtained by physicians after they take an 8-hour training course followed by an application to the Drug Enforcement Administration. Buprenorphine is a partial opioid agonist, meaning it activates opioid receptors but not as strongly as opioids like heroin and morphine. It can reduce cravings and symptoms of withdrawal without producing a high. For this reason, it is one of the drugs used in medication-assisted therapy, also known as MAT, to help treat opioid use disorder. Use of MAT is associated with significantly improved opioid abstinence and decreased mortality, and buprenorphine has few downsides. Despite this, access barriers have been a major issue, and the X-waiver has been one of those barriers. Even physicians with a license from the FDA to prescribe oxycodone and fentanyl have needed extra training before they can prescribe buprenorphine, meaning there's a tighter regulation of a medication that treats opioid use disorder than there are of the medications that cause opioid use disorder. Physicians cite this 8-hour training as a significant barrier to being an MAT provider, and large portions of the United States have few to no doctors that can prescribe buprenorphine. In addition, other healthcare providers, like nurse practitioners, have to undergo even longer training for a waiver. Substantial decreases in opioid deaths have been noted in countries like France after buprenorphine regulations were eased, supporting arguments to get rid of the X-waiver here in the United States. And after many years, we may finally be taking steps toward that. Deregulation was initially proposed by the Trump administration, and their final week in office was paused for review by the incoming Biden administration and is now moving forward again. The recently released guidelines allow doctors, physician assistants, nurse practitioners, and other healthcare providers to prescribe buprenorphine without undergoing the extra training previously required. Advocates of decreased regulation are happy with the steps, but hope to go even further. Under the new guidelines, healthcare providers are still required to apply for the waiver, and if they wish to prescribe to more than 30 patients at a time, they'll still need the training. While the previous administration's proposal eliminated the waiver entirely, something that advocates would like to see happen, the current administration contends that only Congress has the authority to do this. Fortunately, a full repeal of the waiver is part of the Mainstreaming Addiction Treatment Act, a bill to expand MAT that's recently been reintroduced to Congress. There are several issues that must be addressed in order to stem the tide of the opioid crisis. Easing buprenorphine regulation, including elimination of the X-waiver, will help, but we can't become complacent because there's still a lot of work to be done. Hey, did you enjoy this episode? You might enjoy this previous episode on what post-vaccination life is like. We'd like it if you'd like and subscribe down below, and consider going on over to patreon.com/healthcaretriage, where you too can help support the show even during a global pandemic. We'd especially like to thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral Sam.